spark my career in Bollywood. How are you inspired? Well, this one time.
Hello, thank you for joining us here today. My name is Sarah Dexter, and I am an admissions and recruitment specialist for the Brown School at Washington University in St. Louis. And today we're going to talk about the Brown School as a whole and our programs. Today we have with us two of our students, Aishwarya and Kellen, and I'm going to have them introduce themselves with their name, their program, year, concentration, and where you're from.
All right, hi everyone. My name is Aishwarya Nagar, and I'm a second-year Master of Public Health student at the Brown School. My specialization is global health, and I'm originally from New Delhi, India, and I'm really excited to be here.
Hi, my name is Kellen Roybal. I'm a first-year MSW MBA dual degree student, and I'm from Denver, Colorado, and I'm pursuing health and healthcare administration along the social work field. So good to talk to you all.
Great, thank you both so much. So today is really going to be a high-level summary of basically what our info session is that we do on campus. So again, it's going to be high level. If you have the opportunity to come visit us on campus, we highly recommend that because there's so much information that we can't get into those nitty-gritty details today. We also encourage you to use the chat function. If you have any questions along the way, we'll be able to address those at the end of the session. Okay, so here we go. This is a phrase that you may hear frequently when we talk about the Brown School: dedicated to equity and committed to impact. Our faculty and staff are really committed to the work that they do, committed to translating their research into actionable solutions and bringing those solutions into communities where they are most needed. We have 3 degree programs at the Brown School. We have a Master's of Social Work, Master's of Public Health, and then dual degree options with Social Work, Public Health, and then also a Master's of Social Policy. We'll get into that a bit more in future slides. The Brown School is a part of a larger university, Washington University. You can see the Brown School here. We also have the School of Medicine, Law, Engineering, Art and Architecture, Arts and Science, and then the Business School. We'll get into how how you may be interested in some of these schools and how you can interact with them with our joint degree and other elective courses a bit later. So to get an overview of what our student population looks like, you can see here is some demographics on our MSW students from the past year. The age range is from 20 to 64. Average age is 26. Over a third of our students are students of color. Over 50% have lived, worked, or volunteered abroad. Almost a third of our students are Service Corps alum. And then our students come from a wide variety of homes from 35 different states and territories in 25 countries. As for our MPH student population, almost 2/3 of our students are students of color. Nearly 60% have lived, worked, or volunteered abroad. Again, a diverse age range with 25 as the average age, coming from 35 different home states and 12 different countries around the world. So you can see we have a pretty diverse cohorts of students here at the Brown School. So some of you may be new to the fields of social work, public health, and social policy. So we find it might be helpful to give you some working definitions. So what is social work? Social work is a field aimed at improving the overall well-being of populations, especially those that are historically underserved at micro, meso, or macro levels of impact, so at all levels. What about public health? Public health is the science of promoting and protecting the health of people and communities where they live, learn, work, and play. Lastly, we have social policy. Social policy is a discipline that examines and promotes social and health equity for humans locally, nationally, and internationally. Now I want to open up this to our students here and have them kind of talk about what does it mean for them. So Aishwarya, if you could talk about what public health actually means to you, and then Kellen, what social work means to you.
Yeah, public health is a nebulous concept. It took me a while to discover what those words even meant because I was pre-med discovering this world. What it essentially means is that public health practitioners are trying to improve health outcomes. Now, the population in which we try to improve these health outcomes differs. It could be the entire country, it could be a very specific group of people within which there's a disproportionate health outcome, but it's all about just improving the way we live, our well-being in general. So it could be detecting a certain type of infectious disease ahead of time, preventing some sort of a health outcome from happening in the first place, or providing the resources you need to kind of cope with a health outcome after it manifests. So it's very nebulous, and I totally understand, but that's how I see public health.
Great. Thanks, Callan.
So for me, social work is almost equally as grand and big of a field of work, but I understand it as just kind of functioning with and for people at all levels of community. So in the individual level, the group level, and the community level, on integrating them with the resources that they may or may not have around them in their different respective environments, and kind of using a social justice approach to ensuring that they have equitable access to any resources they need. Those resources could be health, could be education, could be food, housing, mental health. The options are limitless when it comes to social work, and so it's really working on the forefront, in my opinion, with and for people so that they can be the best they can be.
Awesome. Thank you both so much for sharing that. So sometimes folks ask, why do we have those programs together under the same place? Because some people see them as very different. But we find that those fields are intrinsically linked. And so our professor here says it very beautifully, why have them under one roof? She says, if we as a society have disparities in income and education, we will have disparities in health. People can't begin behind and just miraculously catch up bearing something extraordinary. Through teaching and research, I want to make the extraordinary possible. And so, like both of our students said, those two fields of study are so important and so vast and complex that, of course, they'll overlap, and of course, they work together. So I want to bring it back to you both. How is this interesting or unique to you? How are having these two programs under the same roof beneficial or interesting to you both?
Yeah, when I was looking for public health graduate programs, I had the option of either choosing very clinical programs that were sort of detached from the equity focus that I believe partnering with social work students brings into my education. I wanted a program like this that is very focused on health equity, because what drew me to public health and not something like medicine is its focus on social determinants of health. That different people experience health very differently, and one-on-one interaction may not be as effective as working on a population level. So for me, working with my social work peers, I've learned from just basic conversations, hanging out in the same spaces, about the kind of values I can bring into my public health practice. Because I want to go beyond sort of the clinical and the computational, and I want to have the people skills, I want to have the right philosophies and the right approaches to make my public health effective and not just sort of data numbers.
Great.
So moving along with what Aishwarya said, I also didn't want to be in healthcare in any type of clinical realm outside of perhaps some therapeutic work, but I know I'm not a clinician at heart or by trade. And so what I found interesting about the integration of social work and public health is that as a social worker, I'm looking at very person-centered values with them in their communities. And public health brings a really interesting approach that from the external factor. And so what's really affecting individuals and the families that I work with is going to be really high macro level issues. And I really like that she mentioned social determinants of health, because that's a big interest of mine, in how people experience health differently, whether you're people of color, women of color in particular, transgender individuals. They all are going to have a different experience in and out of the acute care setting. And kind of streamlining that to make sure their health outcomes are the best that we can be is a really good approach that both the integration of public health and social work aim to achieve.
Great. Thank you both. And so moving along into how that impacts our curriculum here at the Brown School, our curriculum was designed to be transdisciplinary. It was designed to be different. So using evidence-based approach to practice with an anti-oppressive framework, again, transdisciplinary problem solving that approaches comprehensive and sustainable solutions, which prepares our students for new and non-traditional career trajectories. It's grounded in a highly flexible curriculum, and within that curriculum there are skill labs available that are focused on in-demand and applicable skills that you can start practicing when you're in the field. We're also grounded in driving social, racial, and economic and health equity. So then moving into social work concentration specifics, we have 9 concentrations within our Masters of Social Work program. You can see the list here, and at the very bottom you'll notice there is an individualized concentration, and so what that means is students can individualize their curriculum to their specific education interests and desires. In addition to the concentrations, we have 6 specializations. These are optional, as well as an additional MSW certificate, which again is optional as well. We like to think of the concentrations as like a major, so if you're thinking of your bachelor's degree, concentration is a major, specializations are a minor, and then a certificate. So the last 2 are completely optional. And then moving, I did want to mention that our MSW it's 60 credit hours, and it's traditionally a 2-year program, but we do have option for advanced standing for our BSW students. So Kellen, can you share a little bit about, I know you've only been in classes for like 4 weeks?
It's 4 weeks.
Yeah, 4 weeks. So could you share a little bit about your courses and maybe one that's particularly interesting to you?
Sure. So one thing that I really appreciate about my experience in just the 4 weeks that I've been here is the entire first year is dedicated to a strong foundation in what social work is and how that practice comes out in everyday professional life. And the big response is, I just want to get into what I'm really interested in. But coming from a non-social work background, it's really important for me to kind of understand the factors that play into being an effective social worker and really understanding the capacities to which those work in. One class that I never thought I would be in, nor I would really like, is my social, political, and economic environment course. Apologies. And your experience in this course will vary depending on from which faculty member you take it, because they have a lot of creative freedom. But what I really appreciate, what I'm learning here is not only how people make decisions, but how people and policy influence decisions that affect communities at large, and how we as social workers need to navigate these certain influential bodies in order to make the outcomes the best that we can be. And so that's what I really like about that particular class, is it's very high level and critical thinking required kind of class.
That sounds really interesting. I'm kind of jealous that I don't get to study on that course.
It's pretty great. I love it.
That's wonderful. And so similarly to the MSW, the MPH program, also the first year is focused on foundation coursework, as Kellen mentioned. The MPH has 5 specializations: generalist, epidemiology, biostatistics, global health, health policy analysis, and urban design. There also is an optional certificate, which is the Violence and Injury Prevention Certificate. That is a 52 credit hour program and a 2-year program as well. So now I want to ask Aishwarya about your courses. You're second year, so you're in it. So yeah, can you tell us a little bit about your courses and maybe some that have been particularly interesting to you?
Yeah, don't even get me started. I really love our public health program. Similar to the social work program, there are some foundational courses that you have to complete. And although the word biostatistics I was so scared going into it, it ended up being such an amazing class because they used very applicable examples, putting complex biostatistical theories into very, very easy to understand real world applications. My favorite classes, so right now I'm in a transdisciplinary problem-solving class called Global Reproductive Health, and I'm having a blast learning about all the different like policy implications that come with global reproductive health, the biological implications, the like social determinants implications. My global health class, my first semester was incredible because it focused not only on infectious diseases and how they manifest all over the world, but also different ways of looking at how you solve global health problems creatively. I took a global health, gender, and poverty course last semester, which was amazing, but by far my favorite course has been planning, implementation, and evaluation of evidence-based interventions, programs. It's a very long title, but we call it PIE. We lovingly call it PIE. And it teaches you exactly how you start to finish, what happens with a program, what happens with an intervention. You start by planning it and you end by evaluating it. But really, it's a very cyclical process. So I learned all the skills associated with that whole like life cycle of a program. And those are very valuable skills that I definitely know I'll use in my field. I loved it. Oh my gosh, I could talk about it forever.
No, that's wonderful. Again, another course I wish I could sit in and watch. That's fantastic.
You can join us.
Thank you for sharing that. And so, in addition to the wonderful courses we have within the Brown School, the social work and public health, social policy courses, we have some other degree programs and options. We have dual degrees, so if you're interested in both what Kellen and Ashwarya are talking about, you can do a dual degree in social work and public health. In addition to dual degrees in both social work and public health, and then social policy. The social policy dual degree is an additional 1 year. So our programs by themselves are 2 years. And then if you choose to do a dual degree option, that's an additional 1 year. So for those 3 options at the very top, those would be 3 years total for those 2 degrees. Beneath that, you can see our numerous joint degree programs. And so we have a ton of joint degree options within our larger Washington University community. So Kellen mentioned that you are a joint degree student. So he's doing social work and business at the Business Olin School. In addition to that, you can see that there's other options with education, law, architecture, urban design. The list goes on and on and on. So basically, if you're interested in something and you see that we have a school within the university and that, there's a good chance there may be a joint degree option. And it's pretty helpful in shaving off some of those years if you were to take the program separately. Another wonderful thing we have at the Brown School is our 3-tiered advising model. So each student will be assigned to 3 advisors. This is really to build a network of support. You'll have an academic advisor, a faculty advisor, and a field advisor. Your academic advisor is really that person who helps register you for classes, make sure you're completing all of those course requirements, that you're on track to meeting your goals. They also have daily advisor of the day drop-in hours, so if you have questions and you need to chat with an academic advisor, you can pop in and talk to someone there. They're also really knowledgeable about all the different resources at the Brown School and WashU in general. You'll also have a faculty advisor, so they're really great with connecting you to both in the classroom and out of the classroom opportunities within the Brown School and then greater St. Louis area as well. And then your third advisor is your field education or practicum advisor. So they're really there to help with the whole practicum process, from choosing a site to helping you identify goals for your practicum. They're really great resources when you have any difficult conversations, or just you need to chat with someone about experiences at your practicum site. They're there for support as well. And then they also have daily drop-in hours as well. We have some really awesome faculty at the Brown School. Our faculty are the best in their field. They're leading the research, and as a student, you get to kind of hear that research first. They're writing the textbooks that are being used by other schools and other institutions in the classroom. So as I mentioned, you will be paired with a faculty advisor, and so you have opportunities to really get to know your faculty and both inside and outside of the classroom. We have a fairly low faculty to student ratio, so it's 11:1. So your faculty know you by your name and your face and your story. So I'm wondering if Kellen and Aishwarya can talk a little bit about how you've gotten to know faculty and some of the relationships you've been able to forge.
Sure, I'll kick off this onward. As we've discussed, I've only been here for 4 weeks, but in those 4 weeks, I feel like I've made some incredible relationships with my faculty members across the board. My favorite part about them is they're receptive in the moment to not only questions, concerns, needed clarification, whatever may be happening in the moment, but also externally. I actually just went and had a conversation with my SEPI, Social, Political, and Economic Environment faculty member yesterday about kind of how to point my MSW degree and MBA degree into a potential career path. And we had a solid 45-minute conversation about what that juncture might mean for me, particularly, and how that applies to my career goals. And it was just really enlightening to kind of not only get a little bit of validation, but to kind of have some extra thought pokes, I guess. It's a term that I'm making up right now, into just what it means to be a professional. And she welcomed me in, and we, like I said, just had a very good chat. And so that's it. Yeah, and there's very little ego involved with such really renowned faculty here, and I just think that's insurmountable when it comes to the educational experience.
Yeah, I echo that completely. There's so many ways to interact with the faculty here. Not only in the academic setting, where they will not only work with you with your concerns and questions after class, but also guide you in ways you might not have perceived your degree, teach you different ways to look at your degree and what to do with it. Then also professional connections. I've really bonded with faculty over them, but also just in a social setting as well. So I'll speak to all three. Mostly the professional connections. So my practicum this summer, I worked with a professor who just hired me and the other girl that I went with on as research assistants, and has provided some excellent mentorship, not only in our field and the research we're doing, but in general, asking questions about what we want to do with our future and how she can help us. Another professor of mine who is a pioneer in her field of family planning and gender equity and global health has reached out to me saying, hey, do you want to help out with this project, or do you want to help out with this grant I'm working on, or with this program I'm working on? And it's a great it's been an amazing professional opportunity to work, get my hands dirty, work in the field. And then also there are professors with whom I social engagements work out really well. So I'm in this student group, Cells to Society, and my epidemiology professor is our partner for that. So she presents sometimes. We interact with her on that, brainstorm. For my global health student group, we ended up at a professor's house for a potluck. So there's so many different ways with which you can interact with faculty, and it depends really what you want out of it. Do you want mentorship? Do you just want do you just find them cool and want to know all about their life stories?
And they'll tell you.
And they will, exactly.
They'll tell you.
Because the benefit of being in a graduate program is that that power dynamic, I feel, is a little different, because we have students from all walks of life in our programs. So I feel a sense of equality with my professors, where we're kind of coming to the table with our own stories, and they're not looking out at me.
Yeah.
It's kind of hey, Kellen, tell me about your future, and let's work together to get you where you need to go.
Hear, hear.
Yeah, that's great to hear. It sounds like it's more than just those. It's more than just those formal mentorships. That there's a lot of different relationships and opportunities to engage with faculty in super meaningful ways that make sense for you beyond just a research or the mentor advising relationship. In addition to the huge different ways that you can engage with faculty, there's a number of different ways you can engage with research. We have a ton of different opportunities at the Brown School to research along faculty, but also research centers, campus partners. You can do this through independent study, assistantships, fellowships, and research-oriented practicum. We have master research fellowships. If you're particularly interested in that, those applications, it's something you apply for, and those typically go live in February, so you can look out for those if you're interested. We have 14 research centers at the Brown School, and so there's several research assistantship positions that open up throughout the year. again, the opportunity to work along faculty members and the staff at the Brown School who are so knowledgeable and diverse in their interests. You can see that there's a lot of opportunities at the med school, but then several other campus partners. The opportunity to present at conferences, some at the Brown School or WashU, and then throughout the country. And then also supporting faculty by co-authoring papers. So if you're interested in research, we have a place for you. If you're not interested, that's cool too. But if it's an interest of yours, then that's definitely, there's definitely opportunities here. So Aishwarya, could you talk a little bit about your research opportunities, interests?
Yeah, I came into the Brown School knowing that research was something with which I wanted to engage. I just didn't know how. So there were some information fairs where I interacted with our 14 research centers, which is such an amazing privilege to have 14 entire research centers that you could go to. In the end, I did end up doing that thing where you walk to each individual research center and say, you got a job, got a job, based on whose work I was interested in. But right now I'm working with two different sort of research opportunities. One is with the Institute for Public Health. So I work with the Global Health Center, and I'm doing a lot of work around identifying what kind of global health work we do here at the Brown School. So it requires engaging with a lot of faculty members and across a lot of departments to understand this like broad geographic distribution of the work that we're doing and exactly how it is that how global health manifests here within our public health network. But then also I'm working with Laura Ayanati, who is the Associate Dean. She's a Dean of the Public Health Program and my PI. So that's who I worked with this summer. And so I'm working with her on her malnutrition studies, her child development studies. So it's quite amazing. It's a best of both worlds sort of a situation, because one opportunity isn't so like traditional research heavy. It's more like looking for opportunities, and it's making connections, and the other one is like publishing and research and IRB. So research can mean a lot of different things in your graduate experience. It could mean case management, it could mean interviewing people, it could mean doing literature reviews, it could mean writing papers. It just looks so different. So even if you're not entirely interested in research, I definitely encourage everyone to explore that here at the Brown School.
Yeah, I'm glad you mentioned that. I think sometimes, and even I had this idea that research was kind of a scary term, and I had an idea it was like this very specific, tiny little thing. But as you mentioned, it's a huge area, and it's just very diverse, especially here. There's a ton of different opportunities and ways to get involved. That's great. So next we want to talk a little bit about our field education, our practicum piece. As I mentioned, you'll have a field ed advisor who will support you throughout the entire process. It's a pretty unique opportunity for you to be able to select your own practicum site. We have over 400 diverse partner organizations with the Brown School. And then you also have an option to petition a new site if you're interested in a specific site that isn't already a partner of ours. And then, yeah, you'll be paired with a field ed advisor who's there just to really be your cheerleader, be your support person as you navigate that practicum process. So again, going back to you two, Kellen just went to a practicum fair. Again, you've only been here a couple of weeks, but you're coming in hot. You're like, so. Yeah, so could you share just a little bit about your experiences so far in this very short amount of time you've been here?
So the practicum fair was like my first and then possibly a half stint into searching for and digging into the practicum opportunities here. And I think there is a potential benefit to having it so early on in the semester, specifically for first years, because well, we don't start our practicum until the second semester, so you'll be starting probably right after the start of the year in January. It's important to begin thinking about how you might want to direct your attention into what your interest might be for a practicum, whether you want to diversify your interests a little bit and try something outside of your comfort zone, or if you're like, I really know what I want to do, I can search and get on that right now. And so this was a really good opportunity to kind of see several different organizations around St. Louis that are committed to working with practicum students and giving them the best educational opportunity there is. I know I went into this practicum fair not really as prepared as one may be going into a job fair, but for me, I was really in this nebulous cloud of I don't really know how I want to direct my first practicum experience, and so I went into it just asking questions. What do you do? I'm new to St. Louis. How is your community or your organization engaged in the community? What are your outcomes that you're looking for? And what do you expect out of your practicum students, and what are you looking to help teach them? And so I kind of went it with that lens, and I actually have an email waiting for me to apply to a couple of those practicum sites in and of itself. So there's a benefit to thinking ahead so early about what that practicum might mean for you.
Great. And then Aishwarya, you're in your second year, and you've already done your practicum.
Yeah, what a process.
So can you share a bit about that?
Definitely. So in the public health program, you normally complete your practicum in the summer between your first and your second year, although that looks differently. I have peers who are completing their practica now, or they did it in the previous semester. So for public health students, the application cycle starts a little later, so we do start applying in January and have things confirmed when they're confirmed, and then we're ready to go in the summer, except for global health students. So us global health students, we have to apply for a practica early in October, November time period. And that is because it's important for you to know exactly what kind of a global site you're getting yourself into. Global health students are highly encouraged to do their practicum internationally unless they already have extensive international experience. So yeah, the process started very, very early for me. And I thoroughly enjoyed my practicum experience. At every single turn, it was nothing that I expected it to be. But I learned so many skills, and a lot of those are just being flexible where you're at, adapting to the changes around you, knowing full well that you're not going to be doing exactly what you think you're going to do, that your projects change over time. But the work that we did like focus groups with mothers about what they're eating. We actually partnered with the School of Engineering on an air quality study. It's one of Haiti's first air quality studies. So
wow.
A lot of what I did required carrying these like massive air quality monitors up and down stairs into people's houses. So it was interesting, got my workout for the summer.
Yeah.
But it was nothing like I thought it was going to be, but the experience itself was very valuable. Because global health is all about adapting to change. It's all about meeting people where they're at. So I really enjoyed that. I mean, I have peers who worked in the City Department of Public Health, County Department of Public Health. They worked with nonprofits, they worked with startups, they worked with consulting groups. They're doing research in labs. So it's amazing the many different directions your public health practicum can take you. But it gave me the real world experience I need before actually going out post-graduation.
Yeah, that's great. Thank you for sharing that. And I think it was really helpful for you to note that our public health students have one practica, whereas our master's social work students, if they're coming in with the non-BSW as a traditional student, they'll have two practicum experiences. So that's just, that may be helpful to know. And so moving right along, we're going into, we want to share a bit about some of the resources we have at the Brown School. Our students are busy. They have a lot of competing priorities between classes, extracurriculars, research, various part-time jobs that they're doing and just being a person in this world. And so our school really wants to support you throughout all of that. You can see a list of different resources and support systems that we have within the Brown School. Just to name a few, we have the Office of Diversity, Inclusion, and Equity, an entire academic affairs team, student groups and special programs, professional development, Office of Financial Aid, career services, field education, different labs to help with statistics, communication, and then various opportunities to meet with our dean and engage with our leadership at the Brown School. So that's all of that to say is there are a lot of different supports at the Brown School, and we really hope that our students can take advantage of those. And so going back to you two again, if you have used any of these, could you share a little bit about what resources or support systems have been helpful for you?
Yeah. I'll start us off. So the things I really want to talk about, which are really salient to me, is the access to administration here. I've worked in higher ed myself for the past 4 to 5 years in different capacities, and at some institutions, students often report that there is a very hard barrier between their educational experiences and access to speaking to the administrators that more or less control how those educational opportunities are streamlined and put it into the classroom. And here, before I even started school, I had dinner at the dean's house, and I had face-to-face conversation with the dean. And to me, that was just really, really important. And then after the first week, I had 2 different meetings with the assistant dean just about things I noticed during orientation or some concerns I had about class, and they were openly receptive to feedback, and I felt like it didn't fall on deaf ears. They said, okay, how are you thinking we could implement a solution to that? And so it felt very much like a partnership. So that was resource number 1 for me. Resource number 2 is kind of the 3-tiered advising committee, because I'm more or less a self-directed person, but I like to know that I'm headed into the right direction. So I've had conversations with faculty, as I mentioned, but also with my current academic advisor on how to plan through both my MSW and MBA degrees as well, and had a rather lengthy conversation about just those different opportunities. And then the field education office as well for planning out practicum and what my interests may be and where I should start looking, and then how I should get myself out into the practicum fair. So those are my experiences just in the short time that I've been here, and they've all been incredibly positive and highly receptive to my questions, my feedback, my concerns, etc.
I echo that 100%. Our administration here, I get the impression at least that it's incredibly transparent, mostly because we've had town halls, we have the opportunity to interface with them on a very regular basis. Just today we had 2 administrators sitting in the Goldfarb Commons, which is one of our student-centered spaces. And it's amazing to have that because you feel heard, you feel seen, and then also you know exactly where the school's priorities are. But then I guess based on the resources you spoke of earlier, I have loved working with the Offices of Financial Aid and Career Services. So especially with financial aid, I mean, I'm not gonna lie, I was at a point last year with my education where I didn't know if I had the financial resources to go through with it. And the Office of Financial Aid was excellent. Like working with them, I was able to figure out the options that were right for me, able to figure out what would keep me here at the Brown School, and I'm still here, so it's been, that office was very, very useful, very amazing to work with. And then with the Office of Career Services, Kelly and I were talking earlier today, I was talking about how important it is for a program of social work, public health and social policy to have its own career services.
Like
that's not
dedicated to us. Yeah. No one else gets to use it. It's ours.
It's ours. Otherwise, you usually see it with schools of business or the one over here at WashU services the whole undergraduate community and also master's and PhD students in College of Arts and Sciences. So it's very interesting, and because the world is your oyster when you get a social work, public health, or social policy degree, right? Like, you could do anything. So for the individuals who work at the career services to sit down with you and say, okay, it looks like these are the skills you have, these are the strengths you have, and this is how you could use them professionally, I think it requires so much skill. It's amazing. I've had such an amazing time working with them. Like my first week of my first year, I walked in there saying, hey buddy, I gotta work at the UN somehow, and he's like, okay, all right.
Let's plan.
No problem, too big. So he worked with me to figure out a plan. Same with looking at different professional connections. So career services and financial aid, I've had a ball working with them, especially. And then our dean's team is just absolutely fantastic, very transparent.
Great people.
Yeah, that's great. And that's a perfect transition because the next thing I want to talk about was career services. We love that you're a student here, that you're pursuing your passions, but we also recognize a big part of this is getting a job afterwards, right? And so, as Aishwarya mentioned, we have a team dedicated to encouraging you finding your fit with your career and knowing your value. And so here are just a couple of some of the things that they do. They do resume review sessions, one-on-one advising, pop-up events, they do different coaching like salary negotiation workshops, licensure workshops. There's just a number of different things that they do, career fairs, that are instrumental and so valuable for our students. And I think it's important to note that you have access to them from the moment you're a student, but then also as an alum. You can come back 3, 5, 10 years from now, 20 years from now, and you're able to use the Office of Career Services, and they're there to support you through your whole career journey, which is wonderful. And so our grad students go on to do some pretty incredible things, from clinical to policy practice. Our graduates are truly leaders, change makers, and innovators in their fields. Again, these are just a couple of the career paths our students have gone to: CDC, Barnes-Jewish Hospital, CARE International, World Bank Program, maybe the UN, hopefully someday soon. And so this is just a handful, but there's several traditional and also non-traditional paths that our students go on to pursue after they graduate the Brown School, because that's our hope, is that you have truly the world as your oyster to pursue your passions. And so yes, so how to fund your degree, very important. Ashwarya touched a bit on our financial aid office. They're a wonderful, wonderful asset, but we want to note that the Brown School does offer generous scholarships to our students. They provided over $8 million in funds to our students this past year, or 2018-2019 school year. And there's a range of scholarships that are available for students. So any student that expresses interest for a scholarship are considered. If you, in your application, there's a little box that you check and say that you're interested in merit-based scholarship, so select that. There may be a video interview that's required for merit-based scholarship, and more information is provided when you choose that. If you are interested in some particular scholarships, there may be a supplemental essay that's required on that scholarship. There's also a number of limited need-based scholarships that are available for students who demonstrate the most significant financial need, and so a separate need-based scholarship application is required for that as well. And again, we have an office just for our students, the Office of Financial Aid, where they are there to help provide support, break down the jargon, and just be there for our students. And then we also, we're going to move on to questions. We had a couple of questions that were submitted ahead of time, and so we're going to touch on those first. So let's see. Our first question is I think will be relevant to our panelists. So why did you choose the program that you're in? So MSW, MPH, or dual degree. Why did you choose that program at the Brown School?
You want to take this one?
Yeah, let's do it. Okay. So as I was mentioning earlier, with public health, there's like very different directions you could go in with your public health graduate education. And this is the one I wanted because it's a shared school of social work and public health. That is important to me because you can learn content wherever you go, but values are very hard to come by. And I wanted health equity to be the very focus of my education here. I want that to be manifested in any work I do anywhere in the world. So yeah, that's kind of why I chose the Brown School, because of its focus on, especially because of its focus on research, its focus on evidence-based practice, the fact that this program is so transdisciplinary, but most importantly, because of those shared social work public health values.
Yes. She said it all. Plus, for me, I think something that I find really unique about the Brown School is its approach to social work. I can't speak too much to this on the public health realm outside of the dedication to equity, which is so important, particularly in all of our fields. But every other program that I looked at and was accepted to, they were very, you had to choose either direct practice or indirect practice. So are you going to be a therapist, or are you just going to be a welfare social worker? And there was nothing in between. As you saw earlier through our session, we had just concentrations and specializations. So you pick an area of interest And then within that area of interest, you're crafting your experience as a social worker here. And whether you want to work individually, whether you want to work at the macro level, or even in between and fluctuate in different roles, this school will help you do that. And you, in 10 years down the road, if you say, you know what, I want to move into individual practice, you'll have the skills necessary to do that. And so that was one of the key factors that brought me to the Brown School, is I didn't have to choose between. I can pick the area that I was interested in and move forward that way.
Thank you. And so we had another question asking about GRE scores. So they asked, what is the average GRE score of those who are accepted into the program? And so we actually don't really collect that data because we don't have a minimum GRE score. We'll get into this a little bit more in our next virtual info session about tips for your strongest application. But to answer that very quickly now, we take a holistic approach to reviewing our applications, and so with that, it includes your GRE score for the Masters of Public Health. MSW does not require GRE, and so we don't require or we don't have a minimum score, so therefore there isn't really an average score that we collect. And so then we had one more question that was submitted early. So this is from an international student, and so they're asking what makes the Brown School a distinguished program. So there's a couple parts. So what makes the Brown School stand out, basically? How can the knowledge taught at the Brown School be related globally? And then we'll just do those two for now, sorry. So what makes it stand out, and then is that applicable globally?
Yeah, so what made at least on the social work side, the Brown School is reputed for being very, very highly ranked, so that's something that's going for you. But also, so I'll speak to the international public health student perspective. For me, the Brown School stood out because it really focuses on helping you develop the skills that are very, very pertinent and applicable to your field. So some basic skills like epidemiology and biostatistical analysis, that you can apply anywhere in the world, but the values that it equips you with is what I will treasure the most. So especially in my field of global health, you learn to approach problems from a very adaptive and flexible perspective, and just taking into account the cultural norms and the differences and standards of wherever you are. So really customizing problems, customizing your lens, the way you view problems based on that. And just the ability to think that way is the most important skill you take with you. And I think the Brown School really focuses on that. At least for me, that is what will be the most applicable in a global level. So when I go back to my home country, which is India, it's gonna take a little bit of time to get familiar with like, how do you make a policy brief that is specific to the Indian context? Sure, but then the skill that I will use in my field will be directly translatable because I have learned it in its like purest, sort of most customizable form here at the Brown School.
Mm-hmm. Great, thank you. So we got several questions that came in, and so we're gonna have to move through them pretty quickly. So we'll just kind of go right along. So the first question is, how many people individualize their MSW concentration? That's about 10% of our MSW students do that. When do you declare your concentration or specialization? That's typically done during, I should know this.
It's relatively close to the end of your first semester. On your application, it'll ask you to put it in.
Yes.
But you have the leeway to change that should you find something else in your foundation classes.
Yeah. So by your second year, you'll have that selected. MPH may need to know before the fall semester, specifically for global health. That's important to know.
Some of the specializations you need to take courses for within your first semester, so it's good knowing ahead of time. I came in knowing my specialization, but I have peers who switched throughout. So it only matters if you have like a specific course you need to take for that specialization, like global health.
Yeah. So this person asked, can we talk a bit about skill labs, particularly for MSW students? Can you answer on that? Yeah.
Well, the public health and social work student body have the same like skill labs to pick from. Yep. So you can, if you are interested in improving your data management skills, you can learn new statistical softwares, languages, data management skills, that kind of thing. There's also grant writing skills labs, budget management skills labs. Yep. I took on managing and leading teams.
People.
Teams of people, yeah, it's a very long name, but it's all about like what does management and leadership look like in a professional setting. I believe there's social systems design-based skills labs as well. Project management, strategic planning, program planning.
Yeah.
It's just
there are so many different opportunities, and the important thing to know is that they're geared towards skills you want to develop outside of the classroom to use in professional life, and they also count towards a credit. So they are each one academic credit and so you can take a variety. You don't have to take any if you don't want to, but it's really they're just an extra tool in your toolkit, a really refined tool, which is really awesome.
Great, thank you. And so the next question, how does studying public health in the School of Social Work instead of a School of Public Health affect the content and emphasis of the overall program, if at all? Would you care to?
I guess I don't have the like contrasting perspective of what it would be like to study this in a School of Public Health. But it's that crossover that, it's the values you get from that crossover that I do think is the most valuable part of this. Mostly because there's a lot of resources in the social work program that I would never have known about or even thought of if not for the fact that our programs were collaborative. So social systems design thinking, oh my God, I would have never come across that concept if we weren't in this sort of a program. Systems thinking is a very, very incredible, innovative way to look at and to solve problems, like major public health problems. And it's something that's housed in the social work program, but again, it's something that I had access to through my classes, and that's a skill that I will be carrying with me in my professional future. So again, it's those like transdisciplinary skills you get that really matter, those transdisciplinary thought processes. I don't think it's something that I've seen at like a School of Public Health.
And then we do also, I want to note, we also have a really strong partnership with our School of Medicine, and so for folks that may want a little bit more of that clinical knowledge or more of that point of view, there are opportunities at our medical campus as well. Okay, so moving right along, how inclusive are the programs for students of color? I don't know if I don't, could you speak to that?
Yeah.
If you feel comfortable.
Sure. Yeah, so by the nature of the way the social work program is, it focuses on empowering a lot of the issues close to the hearts of students of color. So we have students of color who lead protests, who lead movements, who lead social justice philosophies. And so as you saw with the statistical side of things, that our programs are very, there are a lot of POCs that are in our programs. Especially in the public health side, I believe that the classroom environment brings in all of our perspectives. I don't really feel microaggressed or singled out because of my race. If anything, I feel called in by the way I view things differently, by the way my experiences are different. So obviously this experience is so different for everybody. There's no one representative. But if there's any space at Washington University that is inclusive of the opinions and the thoughts of people of color, it's the Brown School.
It's the Brown School.
Just by the nature of what we do.
That's great. So we've had so many wonderful questions come in. We're gonna take one more question, and then if we weren't able to answer your question, then please email us with your questions, and we'll get back to you in a more eloquent way than how I just said that. So here, our last question is an MPH specific question. So how siloed are the quantitative classes in MPH? Would EpiBio be the only way to get quantitative experience, or are the quantitative courses available in all tracks? So from our perspective, there are opportunities for MPH students to get those quantitative classes in all specializations.
Yep.
It's the foundation coursework. Your first year, you're going to be exposed to all of those things because we want you to be a well-rounded student and public health practitioner. Yeah. Anything to add?
Yeah, so aside from coursework, with the skills labs, that's a great, excellent way for you to get kind of those hardcore quantitative skills you want. So I'm taking skills labs that teach me certain softwares like ArcGIS, which is a spatial mapping, spatial analysis software, and SAS, which helps you do a lot of data management. So you can get quantitative experience that way. And also one of my research assistantships last year was entirely focused on the quantitative aspect of public health. So if your specialization isn't, like if you cannot do it through that, you can do it in multiple other ways. You can also take electives that are quantitative focused. So lots of opportunities. Don't worry about it.
Great. So we have just a couple slides left. We talked about our numerous scholarships. There's also additional ways to fund your degree for those who are interested. Scholarships from the Brown School, external scholarships, fellowships, part-time employment, federal student loans, and then out-of-pocket expenses. If you want to learn more about any of these things that you've heard today or want to talk to some of our fabulous students, you can schedule a customized visit at the link here. You can talk to a current student, maybe Kellen or Ashwarya.
We would love to.
They're incredible. You can connect with our faculty, and then of course there's more virtual info sessions to come. Our next session is in October 10th, tips for submitting your strongest application. So that's when we'll really get into some of those nitty-gritty details of applying for our programs. So next steps, our applications are live. So you can see those on the links provided, brownschool.wustl.edu/MSW apply/MPH apply. We also have fall preview day this Friday from noon to 4. So if you're in the area, if you're somewhat close to the St. Louis area, we would love to have you here. It's an awesome afternoon that gives you kind of a deep dive into some of the courses and programs and resources that we have to offer. If you have any questions, I would love to chat with you. Again, my name is Sarah Dexter. I'm an admissions and recruitment specialist, and my email is below, right there, sdexter@wustl.edu. And then we're on the road. It is that season. So within the next month, we'll be in all of these places. So if you live in these places, we would love to meet you. We would love to hear your story, get to know you. We'll be at a number of idealist fairs, TIFF fairs, this is public health, college fairs, and then a few service corps fairs as well. So I think we are a bit out of time. I want to thank Kellen and Ashwarya so much for being here today and for sharing your wonderful and hilarious insights. It's been a joy, and just thank you so much for being here, and thank you all for sitting here and watching and being here with us. Again, if you have any questions, please don't hesitate to reach out, and we'll be here next month for tips on your best application. Thanks so much.